Hello, thank you for visiting this training video hosted by DXC Technology. Today, I'm going to show you how to enroll a new individual provider in the Provider Management module for Vermont Medicaid. Before we begin, please note that this video is intended for informational purposes only and does not guarantee approval of your enrollment in Vermont Medicaid. If you have further questions regarding Vermont Medicaid's enrollment criteria, please contact the Enrollment Department at DXC Technology at 802-879-4450, option 4, or you can email us at vtproviderenrollment@dxc.com. For today's presentation, I'm going to start on the homepage of the Provider Management module. You can access the link to the Provider Management module by accessing www.vtmedicaid.com and click on the Enrollment tab. To begin a new application in the Provider Management module, I'm going to first click on the menu button located on the top left-hand of my screen. Under that, I'm going to hover over Provider Enrollment, and I'm going to click the New Enrollment button. This is going to bring me to the welcome page of the application. This welcome page is designed to provide you more information of what you may need in order to complete your application. So it's going to give you some text at the top here with some information that is recommended to have available during the enrollment process. What is also noted here is an enrollment checklist. This means that if you wanted to get more information of what is going to be required from you in order to complete your application, you could enter in an enrollment type here by selecting from the drop-down menu. You can select your provider type and specialty, and just a couple questions regarding your tax ID and if you're enrolled in Medicare currently. This will generate a pre-checklist for you. That pre-checklist is designed to let you know all the information based upon your selections, what you're going to need in order to complete your application so that you can have all the information ready as you're filling out your application. Once you are ready with the information, you can click the Start button. This is going to bring you to the registration page. Every application is required to register first before starting the application. By registering, this generates a new application and assigns an application tracking number, or an ATN. So what I'm going to need is to fill out my email address and confirm it, and then select a password and confirm my password. You want to make sure that the email address that is being recorded here is whoever wants to get information regarding this application. So if I'm the one that is going to be completing the application, I want to make sure that my email address is here so that I will receive those email notifications. You can choose to add a provider reference if you so desire. This is just a reference internally that will help you throughout the application to identify which application you're currently working on. Once you've entered in the necessary information, you can click Register to continue. This is going to launch a brand new application. You'll notice first that you get a registration complete box letting you know what your application tracking number is. And it's also going to let you know that that application tracking number was emailed to the email that I registered with. So you don't necessarily need to keep it with you at this time and note it down. It will be in your email, and you will see here that it's going to follow you throughout the application. So in order to continue, I'm going to hit OK. A couple things to note before we get started into this application is that there's several different levels of help within the application itself. First of all, there is page level help, meaning that if you are unsure about a specific page that you're working on, page level help is available indicated by a blue question mark. This is located at the top right-hand corner. If you click blue question mark, it'll give you more information about how to complete the page that you are currently on. If you have questions regarding a specific field that you're trying to complete, there is a gray question mark. And if you hover over that gray question mark, it's going to give you more information regarding that specific field. You'll also notice there are blue asterisks on many fields, and that means that these fields must be completed in order for you to continue on. So the first thing that I'm going to complete is the enrollment type. And as noted at the beginning of this presentation, today I'm going to do an individual application. Once I select that, you're going to notice that first there are many tabs that are populated behind the scenes here. And it's going to bring up a box that's going to tell you once you have selected your enrollment type and you've navigated past this first page, this general information page, you've hit save and continue, you're not going to be able to go back and change the enrollment type. That's going to be true for the provider type as well, as you'll see once we move on to the next field. And the reason for this is because the enrollment type and the provider type that you select drives the rest of the application. We're only going to ask you information related to those two pieces of information that you've selected, so you're not able to go back and change it because the application moving forward is already designed for those two pieces of information. If you do move on to a different tab and you realize throughout the application that you chose the wrong enrollment type or provider type, you would simply want to start a brand new application over. So I'm going to hit OK to proceed. And next I'm going to select my provider type. And today I'm going to choose physician. And again, I'm going to get that box that just says once I've navigated past this page, I'm not going to be able to change the provider type. Next, I have to select an effective date. You can select for Vermont Medicaid up to 1 year in the past or up to 90 days in the future. So I'm going to go ahead and select 2/1 of 2020. I'm going to scroll down to my provider information. I am an individual provider, so I'm going to fill out the fields that are necessary to fill out here. I'm going to put in my last name and my first name. You are not required to enter your middle name, gender, or ethnicity, but you can if you so choose to. You do need to put in a birth date, a social security number because this is an individual application, and then you are required to enter in a valid NPI. The system does recognize that an NPI needs to be 10 digits long and valid, so if you don't enter in a valid 10-digit NPI, it will kick back to you and not let you proceed with the application. Next, it's going to ask you a few questions if you are currently enrolled as a provider. If you chose yes here, basically what it's going to say is, did you actually mean to revalidate? The revalidation process is different than a new enrollment process. So if you are trying to revalidate your application with Vermont Medicaid, this is not the right avenue to do so. So if you were to choose yes, that you are trying to revalidate, it's going to bring you back to the home page in order to select the right choice to revalidate instead of start a new application. We are not here to revalidate today, so I'm going to hit no and go back and choose no. It's going to ask if you were previously enrolled as a provider. Again, if I choose yes here, it's going to populate a previous provider identifier and ask me what my provider number was with Vermont Medicaid when I was enrolled previously. And lastly, it's going to ask if you're Medicare enrolled. I'm going to choose yes here, and you'll notice that nothing populates in this page, but because I chose yes later on in the application, it's going to ask us for that Medicare information. Next, I'm going to fill out contact information for this application. So this is the contact information for this specific application, who wants to be contacted with notifications of denial, approval, something that is returned, anything to do with this application itself. So I'm going to put in my name and my address, and you'll notice that once I tabbed past the zip code, it's going to process through what we call an address doctor, meaning that it's going to go through the USPS software to validate the address that I put in. And it's going to come up with a suggestion here. So it's suggesting to me to change it to this address, adding the last 4 of the zip code. I'm going to go ahead and do that by clicking in this entry. However, if you did not want to accept the changes that it is requesting, you can simply X out and it will keep the information that you have selected. I am required to put a phone number in here, so I'm going to enter in my phone number. And I am going to enter in an email address. You'll notice that this is not asterisk as being required. However, the preferred communication question right below the email address asks if you want to receive communication either by email or mail. It is your choice, but if you do select email, you will be required to enter an email address here in order to continue. If you were to try to continue without it, it's not going to let you do so. We highly recommend that you choose email as your preferred communication, as you are going to receive notifications regarding this application much more efficiently via email than regular mail. So I'm all done. I'm at the end of this first page, but before I hit save and continue, I just want to go back up to the top to reiterate that you want to make sure that you have chosen the correct enrollment type and provider type that you intended on this application, because as noted before, if either one of these is incorrect and you hit save and continue, you're not going to be able to go back and change that. You're going to have to start over. For today's purposes, these are both correct. So I'm going to navigate back down to the bottom of the screen and I'm going to hit save and continue. This is going to bring me to the Specialties tab of our application. So you'll notice now that at the top, and once I've saved and continue, I've got a navigation bar here located at the top of my application. There's a progress bar that shows me where I am in the progress, as well as each tab and what tab is coming up next. It lists them by name. And you'll also notice that I'm not able to click on and move forward without completing the tab that I'm currently on. So it shows what I'm currently on by marking it in yellow. Anything that I have not completed yet here is marked in blue, and anything that I have saved previously is marked in white. So I can go back to the General Information tab and enter and update information on that tab, except for the enrollment type or provider type, but I'm not able to move forward. I have to do these in order. So I'm going to enter in at least one specialty associated to my provider type. You'll notice that my provider type is listed here. So in order to do so, I'm going to click the Create New button located on the right-hand side. This is going to bring up a new window, and you have to select at least one specialty as your primary specialty. So I'm going to make this specialty my primary. I have to choose from a drop-down of specialties, and as noted before, when we say that the provider type really drives the application, because I chose a provider type of 005 for a physician, I'm only going to see specialties that are allowed with that provider type. So if you are looking through the specialty list and you are not seeing your specialty listed here, you really want to go back to the provider type to make sure that you chose the right provider type in order to include your specialty. So I'm going to choose General Practice for today in 001. And next I have to select a taxonomy. And just like the specialty, I'm only going to see taxonomies that are associated with the specialty that I chose. So because I chose an 001, I'm only going to see taxonomies allowed with that specialty. So I'm going to go ahead and choose the General Practice taxonomy. You have to give an effective date of this specialty. You just want to make sure that if you are requesting a back date for your enrollment, that your specialty encompasses back to include that effective date that you're asking. So I'm going to put 2/1/2020 here on my specialty. Once I've entered in all the information, I'm going to click Save. Now you'll notice that I have an entry listed here in this big box, and this is my primary specialty. If I had more specialties to enter, I would simply hit Create New again, which would bring me back to a blank box. I don't want to make it primary because I already have one, but I could choose another specialty here. I'll choose anesthesiology. Again, anesthesiology is allowed with provider type 005, and then I'm going to choose the taxonomy associated to that anesthesiology specialty. Again, I have to put an effective date, and I'm going to hit Save. So now you'll notice that I have multiple specialties listed here. So you're able to make as many entries as you do have specialties in your specific field. If you have additional taxonomies to a single specialty, you would report those here. So for instance, under General Practice, if I have multiple taxonomies to note for that 001 specialty, I can't put more than one up top here, so I want to report that down below here. So to do so, I'm going to hit Create New. And I'm just going to go ahead and select the taxonomy that's associated to that General Practice. The reason for this is because I cannot duplicate a specialty in the box above. So I would not be able to put another instance of 001 into this specialty box. If you have a different taxonomy, you want to report that here down below. Once you have reported all of your specialties and all of your additional taxonomies, you can hit Save to continue. The next tab that's generated for us is the service location information. This is information regarding your practice location, your service location. So in order to enter in that service location information, I'm going to hit Create New. And this is going to bring me up a blank screen that allows me to enter my first service location address. You have to make one of your addresses primary. So again, I'm going to make this my primary. And I'm going to name this location. So I'm going to name this office location 1. I have to put in the contact information for this service location address. Now, this may be different than the contact information that you entered on the first page, the general information page. That contact information was contact information for this specific application, but your contact information for a service location may be different. You may want somebody else listed to contact in order for information regarding that specific service location. So I'm going to enter in all of the asterisk information. It's going to ask me for a county. I'm going to go ahead and enter that county in. And then once again, you'll notice that once I tab through the zip code, it's going to go through the USPS software again and enter any suggestions for address changes. And I'm going to go ahead and select that. And then it also wants an email address for that service location. Again, may be different than the contact email before. It may be somebody else entirely that you want to contact for this specific location. We have to enter at least one phone number for the service location, so I'm going to do so by hitting Create New. And I'm going to go ahead and put in a work number for this service location. You can enter an extension if one is needed and hit Save. If you had multiple phone numbers to report, say you wanted to report a fax number or a cell number, you can definitely do so by just hitting Create New and creating a new entry. You are required to enter in your hours of operation, so I'm going to do so by clicking the button, and that's going to open up another window in order for me to tell what my hours are at this specific service location. So again, I'm going to hit Create New. You'll notice that throughout the application, it all works the same way. It's very congruent and easy to manage. I'm going to select the days that I'm open. So for today's purposes, I'm going to select weekdays. But you could, if you had different office hours on different days of the week, so say Monday, Tuesday, and Wednesday, you worked from 8 to noon, and then Thursday and Friday you worked noon to 5, you could definitely note that here because you can select certain days of the week. But for today, we're going to say that we work weekdays, and I'm going to select 8 a.m. to 5 p.m. Once I've entered in the information, I'm going to hit Save to continue. So it's going to ask if the service location is ADA compliant, if the service location is accessible by public transportation, and what are your after-hours arrangements. So I'm going to go ahead and note that we instruct patients to call the emergency room in this instance. We're also going to ask you if you're accepting new patients with special needs, if you choose to opt out of the provider directory, which we don't recommend because we want to make sure that members have access to all of the necessary information for them to be able to choose an enrolled Vermont Medicaid provider. So we highly recommend that you don't choose to opt out of that provider directory. If you do have age restrictions for the patients that you see, you can select the box, which will then allow you to tell us the minimum and maximum age of patients that you see in your facility. We're going to ask if you're accepting new patients. You can select you are accepting new patients, existing patients only, or only select accepting family members. And then if you have a preferred patient gender for your practice, you can definitely note that here, or you can say no restrictions. Once you've entered in all the information for that first service location, you can hit Save to continue. And now you'll notice that my first office location is listed here under the box. If I had more service locations that I practice at, I would want to continue this process and enter in that second service location. So in order to do so, I'm going to hit Create New again. This time I am not going to make it my primary because I've already selected a primary location. So I'm going to name this Office Location 2. And again, just like before, I have to enter in contact information for this specific Office Location 2 location. So if this is again, may be different than your contact information for the application. It may be different than your contact information for office location 1, or it can be the same. It really just depends on who you want Vermont Medicaid or DXC Technology to contact in the event we need to get a hold of somebody in a specific location. So I'm going to put in the name and the address for that service location, accepting the USPS recommended changes. I'm going to enter in my email address. And then I'm going to scroll down and I'm going to enter in a phone number. Again, it's the same information that you had to put in before, the same requirements, just making sure we've captured all of the information for any given specific service location. So for my hours of operation this time, I'm going to say that since I work at the primary location Monday through Friday, I'm going to say that I work weekends at this location, and I'm going to work weekends from, let's just say 9 o'clock to noon. We'll give them somewhat of a weekend here. And we'll say 12 o'clock. So I'm going to hit save on that. That's going to enter in my hours of operation. We're also ADA compliant and accessible by public transportation. And then, of course, in the event where we're not available, they can contact the ER. So once I've entered in all of this information again, I'm going to hit save to continue. And now you're going to notice that I have 2 office locations. So if you have multiple, you can repeat this process as many times as you have service locations. You just want to make sure that you're reporting all service locations on your application. Once you've entered in everything that is important for you to report, you're going to go ahead and save and continue. Next on our application is the Addresses tab. This is where you're going to give us more information regarding addresses for your pay to and your mail to address. So you have a couple different options here. You can fill out the information if it is different than your service location information. So if you wanted a different address to send payments to, you would want to enter that information here, and you can definitely type this out. If it is the same as your service location information, you can simply check the box, same as service location information, and it will populate that for you. So we're going to say that our pay to is the same as our office location 1. And we're going to go ahead and do the same for our email address and for our phone number. And now you'll see there's nothing else for me to do within this address. I've already filled it out. I've just copied it from the service location information. For our mail to address, again, you have the same option. If you drop this box down, you can copy from the service location information, or if the pay to was different than the service location, you could copy the pay to. For today's purposes, we're going to say that this is different than either one of those addresses. So we're going to enter in our information here. And we're going to just give it a different address. So you can see this operates just like every other address. We're going to enter in the information. We're going to tab through that zip code, and it's going to go through that USPS software. We're going to accept the changes. And then we're going to say that our email address is the same as our service location address. That email address isn't going to change. So you really do have a lot of options to tailor this how you want. If some information is the same and some is different, you have the option to copy some and not all of it. We do want to make sure that our preferred communication is email. It's going to default to mail, so just make sure that you're changing that to email when appropriate. Again, we do highly recommend that you choose email, as you're going to get information regarding the service location much faster this way. You do have the option to give us different address information for prior authorization, remit to, legal, or medical records request. So if your address is different for any one of these purposes, you would want to expand the selection. So we'll go ahead under prior authorization and hit the plus sign on the right-hand side. That's going to expand that selection, and it's going to allow us to enter in a prior authorization address as needed. You'll notice that this is not required. However, if you start an address, you must complete it. So for instance, I can't just fill out a contact name. I would have to fill out every piece of this information in order to save it properly. For today's purposes, we're going to say that everything is the same. So I'm going to just minimize that, and I'm going to hit save and continue. So the next tab we're going to complete is the capacity tab. And this is where you're going to tell us by specialty what your capacity is for the member count for each specialty listed. So for instance, we have 2 specialties that we listed in the specialties tab earlier on this application. So you'll notice we're going to have to enter this twice in order to tell what the capacity is for each specialty. So first I'm going to start with general practice, and you'll notice there's already an entry here for me. So I'm going to simply edit this entry by clicking the pencil icon. And I'm going to select the maximum, and I'm going to enter the maximum Medicaid member count for this specialty. Once I've completed that, I'm going to hit save. And now you'll notice that it has edited this entry. I'm going to do the same thing for each specialty listed here. We have 2, so I'm going to go down to anesthesiology. And again, I'm going to edit this entry by clicking the pencil icon. And I'm going to enter the maximum Medicaid member count for this particular specialty. Once I've entered in the member count for each specialty listed on this page, I'm going to hit save to continue. This brings me to the Organization tab of our application, and this is where you're going to provide organization details. The first thing that you must enter is the organization type, and you're going to select from the drop-down menu. So for today, I'm going to just select I'm an individual. And then you need to tell us your tax classification, again by selecting from the drop-down. And I'm going to say I am an LLC. If you are registered with the Secretary of State, incorporated, chain affiliated, operated by management company, domestic owned corporation, or foreign owned corporation, you're going to want to check the box next to the appropriate field. If you are registered with the Secretary of State or incorporated, you're going to want to give those dates here located on the right-hand side. Once you've entered in all the necessary information, you can hit save to continue. Our next tab is the Credentials tab. Here you're going to give us information regarding your degree, your license, Medicare participation, and DEA information. So starting at the top here, it is not required that you give us your degree information. However, if you choose to do so, you can simply do so by hitting the Create New button and entering your degree, the school in which you received that degree, and your year of graduation. Once you've entered in all that necessary information, you can hit save to continue. But again, this is not a required field, so you don't have to complete this if you choose not to. You will be required to give us your license information. So again, you're going to do so by hitting Create New under License. You're going to give us your license number, the issuing state. So I'm going to choose Vermont since we're in Vermont. The issuing board, and the effective and end date of your license. Now again, it's important to remember that the license that you are entering must encompass your enrollment effective date. So if you are asking for an effective date back to 7/1/2019 and you put an effective date of your license as 2/1/2020, it's not going to allow you to continue because it's going to state that you didn't have a license for the time that you're requesting. So you want to just make sure that you've entered in that license date appropriately. And if that means you need to put in 2 licenses here to encompass all dates, you can definitely do so. Once you've entered in the license information, you can hit save to continue. Under the license will be Medicare participation. Now remember back to the general information tab at the very beginning, there was a question asking if we were Medicare enrolled. And at that time, I noted that it didn't let me put in any information there, but later on in the application, it was going to ask me for that Medicare information. This is where we're going to put in that Medicare information for our Medicare participation. So again, we're going to hit Create New to create a new Medicare participation entry. We do want to be considered for Medicare crossover claims. We want our claims to cross over to Medicaid directly from Medicare. So I'm going to go ahead and check that box. I'm going to enter in my Medicare number. which type of Medicare that I am enrolled in. So if you're only enrolled in Medicare Part A or Part B or D, you would want to put that information here. I'm going to go ahead and choose Medicare Part B. If I'm also enrolled in Medicare Part A, so if I have multiple enrollments, I would enter those individually. I am going to put an effective date of our Medicare enrollment as well as an end date. Once you've entered in all the necessary information, you can click Save, and that will put an entry into our Medicare participation. So again, if I'm also enrolled in Medicare Part A, I'm going to go back through, hit Create New again. Again, I do want to be considered for Medicare crossover payments. I'm going to enter in my Medicare number, and this time I'm just going to choose Medicare Part A. Still putting in those effective and end dates and hitting Save to continue. And now you'll see I'm enrolled, telling Medicaid that I'm enrolled in both. We are going to ask if you are enrolled in another state Medicaid program. If you choose yes, a box is going to open up and you will be required to give us the program, the state, effective, and end dates of that enrollment in another state Medicaid program. If you are not enrolled in another state Medicaid program, you simply choose no, and that box is removed. If you hold DEA, you would want to enter that information here. Again, it's not required because it may not be applicable for everyone, but if you do have that DEA, you're going to enter it here. I'm going to do so by hitting Create New. I'm going to enter in a DEA information or a DEA number, again with my effective and end date. This time I'm going to hit Save, and you'll notice that the module is designed to know certain information and require that information. So I wanted to show you this for instance. This module is configured to state that a DEA, a valid DEA, they're expected to see 2 letters followed by 7 digits. I entered 9 numbers, meaning that it didn't recognize that as a valid DEA, and it will not let you continue. So it's designed to make sure that you're giving us all the right information before you submit your application to improve process time. So I'm going to go ahead and update this to include 2 preceding letters followed by 7 digits. Also notice that I need to update my end date here. They can't be the same. And once I've done that, I'm going to go ahead and hit Save. And you'll notice now that it expected to see 2 letters plus 7 digits. So now it's accepting it as a valid DEA number, and I can continue on. Once you've entered in all the necessary information on this page, you can hit Save to continue. Our next tab is the Provider Type tab, giving us more information regarding your provider type. The first question on here is going to be, are you applying as a primary care provider? So if you choose yes, you can move on that you are a primary care provider. The next thing that it's going to ask is if you hold a CLIA. So if this is applicable to you, you want to create new and supply us with a CLIA number, CLIA type, an effective and end date of that CLIA. If you don't have a CLIA, this is not a required field, so you can simply hit Save to continue. Our next tab is the Other tab. This is where you're just going to give us some more information regarding languages, certifications, and malpractice information. So I'm going to start with languages here, and you want to hit Create New, and you want to select first your language that is primary, that is spoken at your location. So I'm going to choose English for today and hit Save. And you'll notice that I can do this as many times as I do have languages spoken at the office. So if we also speak French at our office, I'm going to just simply select French, hit Save to continue. There's no dates associated with this. We just want to know and provide the most up-to-date information to our members regarding any languages spoken at your service locations. Under that will be certifications. Again, this is not a required field, but if you hold certifications, you're going to want to enter this information here. You'll be required to give us the specialty that the certification is associated to, the certificate type, the certificate number, and your effective and end dates of that certification. If your service location has a website that you want to provide to our members to be added to the provider directory, you want to enter that URL here. Just make sure that when you're entering in that website that you begin it with HTTP or HTTPS in order to make it a valid URL. Under that, we're going to ask you for malpractice information. This is required on your application. So I'm going to hit Create New. First, I'm going to select the type of carrier. This one is going to be professional liability, the name of the carrier, the policy number, the aggregate coverage amount, and the per occurrence amount. Now you're going to notice that I did not enter any special characters into those amounts. I didn't enter any dollar signs or commas or decimals. The module will not allow any special characters, so you want to just enter in the numerical values of your coverage amounts. The module is also designed to understand that the aggregate must be more than the per occurrence, so it won't allow you to continue if the per occurrence was more than the aggregate in case you accidentally switch those two. And I've got to put in my effective and end date. Once I've entered in all that information, I can hit Save to continue. Under the malpractice information will be a question asking if you have in the last 10 years been involved in a malpractice suit or claim. If you choose yes here, a new box will open up and you will be required to give us more information regarding that malpractice suit or claim. You're going to be required to give us the patient name involved, the policy number, the status in that case, the claim and plaintiff that filed the suit, and the status of that claim. If you choose no, that box goes away and you can continue on. If you have a medical related organization to note here, this may include ownership for a lab, home health agency, radiology facility, or something similar, you would want to enter that information here. Once you've completed all the necessary information, you can hit Save to continue. Our next tab is the EFT tab, the Electronic Funds Transfer. You'll notice here that there's only one question initially, and that is, do you wish to enroll for electronic funds transfer? We highly recommend that every Vermont Medicaid actively enrolled provider chooses EFT as their way to receive payment. This payment comes to you much quicker. It is direct deposited. You do not have to wait for a paper check. So for today's purposes, we're going to click yes. And you'll notice all this information opens up to us. First will be the provider information, and this is copied from earlier on in the application. So you'll note that I can't change this because this is what we had noted earlier on. If you see that something is wrong here, you're going to want to go back to the beginning of the application to update that information, which will in turn update it here. It'll also give us provider identifier information, including our tax ID, which is our social security number in this case, the MPI we provided, our license information, and our provider type and taxonomy. What's going to be required here is financial information. You don't need to provide us with contact information, agent information, agency, or retail pharmacy information unless it's applicable. So if you have information to report in these categories, you would simply expand it by clicking the plus sign on the right-hand side. It's going to open up more information for you in order to be able to give us that information. But again, this is not required. You want to scroll down to the financial institution information. So you're going to want to give us the name of the financial institution. You do not need to give us the address of that institution. You're going to need to give us the routing number, the type of account, and the account number. Below that, you can choose to link this account to either your tax ID or your NPI. You can toggle between those two. I do want to note at the bottom of this page is a submission section which states include with your enrollment submission and provides a drop-down box. At this time, no additional documentation is required. This means that you don't need to send us any voided check or any bank documentation along with your application. Once you have entered in all the information and reviewed your entry, you can hit Save to continue. The next page of our application is the disclosures page. You're going to want to read the Privacy Act notice statement and the ownership and controlling interest information located at the top of this page. Below that will be disclosure forms. All providers are required to submit a provider self-disclosure, so we're going to start with that form first. You'll notice that all of the statuses are currently new. In order to move on from this page to save and continue, all of these statuses need to be complete. So to do so, starting with the provider self-disclosure, we're going to hit Create New on that line item. That's going to open up a blank provider self-disclosure form to us. You'll notice at the top, it has pre-populated my information from earlier on, my name, my social security number, and my birth date. And then it's going to have a series of questions that I'm going to need to answer for my disclosure. It's very important that you read each one of these questions very carefully, as you may be required to answer them yes or no based upon that question. So first up is going to be our licensure information. So I've read through these questions, so I'm going to go ahead and answer them appropriately. But again, you're going to want to read each and every one of these questions to make sure you're answering them correctly. I'm going to answer no to this first question, and you'll notice that the box that was here has disappeared once I entered no. If I choose yes here and leave it as yes, I'm going to need to enter in more information regarding why I chose yes on this question in order to be able to continue. So I'm going to go through here and I'm just going to answer each one of these questions. Next is affiliations, then education, substance registration, investigations, liability, legal history, job performance, and then there's some general questions. Under the general questions section will be a place to enter contact information for auditing purposes. Again, this contact information may be different from any contact information that you entered earlier on in this application for the application itself or for the service location information. This is specifically for auditing purposes. Who do you want us to contact in the event of an audit on your information? Again, I'm going to put my name and address, and just like every other address here in this application, it's going to go through that USPS software. I'm going to select the changes. I have to enter in an audit phone number. Who do I contact and what is their phone number? Under that address will be a physical location of your records. We want to know where are your records being kept. For obvious reasons, this cannot be a P.O. box because your records are not being kept within the P.O. box. So we're looking for a valid street location here. I'm going to let it go through that USPS software. I'm going to accept the changes by clicking it. And again, provide a phone number for who we should contact regarding medical records specifically. Under that will be a question regarding taxes. Now I want to just take a moment to note this question states, I declare under the pains and penalties of perjury that I am currently not in good standing with any and all taxes due. So if you choose yes here, you're telling Vermont Medicaid that you are not in good standing with your taxes. This is why it's really important to read each question very carefully. I'm going to choose no here, stating that I am in good standing with my taxes. Under that will be just a couple more questions, one regarding criminal offenses, and then a couple under subcontractor ownership. Once you have gone through this whole disclosure form and answered the questions appropriately, you can hit Save to continue. You're going to notice that's going to bring us back to the disclosure page of our application, and under Provider Self-Disclosure, the status is now completed. Of course, again, for obvious reasons, you can only complete one provider self-disclosure. However, under the rest of the disclosure forms, you may have multiple entries. So I'm going to have to action each one of these other disclosure forms. Now, I may not have a subcontractor, ownership and control interest, managing employee, or business transaction. However, in order to continue, as I noted before, these have to be in complete status, which means I have to action each one of them in order to continue. So I'm going to start by actioning the subcontractor disclosure. I'm going to do so by hitting Create New. Now for this application, I don't have any subcontractors as outlined in the beginning part of this. So the first question is, has the provider had business transactions with any subcontractor totaling more than $25,000 during the preceding 12-month period? It defaults to yes, and all of this information is needed. If you do not have any, you can simply hit no. Everything else goes away, and you can hit save. Now my subcontractor disclosure is in a status of completed. I'm done with that one. But if you chose yes, entered in a subcontractor disclosure, and had more than one, you can hit create new again and enter as many subcontractors as you have to enter. I'm going to go down to ownership and controlling interest. Again, I'm going to hit create new on the line item. It's going to bring me up a blank ownership and control. And again, it's going to ask me, is there an entity with an ownership or controlling interest in the disclosing entity as described above, meaning 5% or more in the provider? If yes, go ahead and fill out all of the necessary information, but if no, you can hit no and continue on. Next up is managing employees. I'm going to hit create new, and I do have a managing employee, so I'm going to go ahead and finish filling this information out for you so you can see what it looks like. So again, as defined at the top, if you have a managing employee, you're going to want to enter in the information below. So first, what it's going to ask you is, what is the relationship? I'm going to say that this is a true managing employee. And what is their last name and their first name? What is their social security number? And the reason that we ask this is because disclosing entities are also screened in the provider's application as well as the provider themselves. So we're going to enter in all the information regarding that disclosing entity themselves. I'm going to let it go through that USPS software, and I'm going to go ahead and accept the changes when it comes up. I have to provide an email address for this disclosing entity, so I'm going to go ahead and do so. The effective date, when did this managing employee start working for you? It's going to default to the end of time for 12/31/999. However, if you have an end date in sight for this managing employee, say they're a temp and they're going to be there for a year and you want to enter an end date, you can certainly change this to do so. We're going to ask you a series of questions regarding this managing employee. Has this person been convicted of a criminal offense? If yes, you'll notice there's a box down here. You will be required to give us more information regarding why you chose yes here, the offense descriptions, the conviction date, and the jurisdiction. If no, that box goes away and you can move on to the next question. So again, just like your provider self-disclosure, you want to review each one of these questions very carefully to make sure that you are answering appropriately. If it's yes, you're going to want to give us more information regarding why the answer was yes on these questions. Once you get to the end, you've answered all the questions, you can hit save. And again, if I have another managing employee, I can simply hit create new again. It will bring me another blank entry, and I can enter in as many managing employees as I have. Last but not least is our business transaction. So just like the others, I'm going to go ahead and hit create new. I'm going to look at the description of a business transaction, and I'm going to answer the first question if the provider entity has any significant business transactions with any wholly owned supplier or subcontractor in the preceding 5 years. If yes, enter all the information necessary. If no, click no and hit save to continue. Now I have met all the requirements to move on to the next page. If at any time you want to look at the information that you have entered, so for instance, if I'm reviewing my application and I wanted to see the disclosure that I filled out for my managing employee, you simply click anywhere within the line item here. So I'm going to click under managing employee, and that's going to bring me up my disclosures. So if I had multiple here, it would list them all here, and I can edit them by clicking the pencil icon. It'll bring me back to that disclosure form for Rebecca Tony, and I can edit it as needed, or I can simply review the information. Once you are done, everything's in a completed status and you have entered all disclosing entities, you can hit save to continue. The next page of our application is the attachments page. This is where you're going to need to provide specific documentation and attach it to your application in order to continue. So for a physician with a specialty of general practice, the required attachments are going to be an IRS W-9 form, proof of professional license, and proof of professional liability insurance. The top portion here is simply to tell you what is required and if that requirement has been met. So right now you'll see under requirement met, it says no. Each one of these has to say yes in order for us to continue. So to do so, you're going to scroll down to the bottom of the page and you're going to start by going through the attachment details and creating an attachment for each one of the attachment types listed above. So I'm going to start by hitting create new. And I'm going to tell Vermont Medicaid how I'm going to transmit this documentation to them. So you're going to do so by selecting from the drop-down list here. Now, we highly recommend that you choose electronic only. That means that you are uploading the document right here onto this page of the application, and when you hit submit of your application can immediately go through the screening process and be put in a queue to work. If you choose any other method, say you wanted to fax them or email them or mail them into us or bring them to us on site, once you hit submit on your application, a timer starts for that application and it sits in a holding period waiting for those attachments. That means that you have 14 days to get the attachments to DXC and have them uploaded to your application before your application expires. So if they are not sent to us within those 14 days, your application will be locked out and you will have to start over. This is why we highly recommend that you choose electronic and scan them and upload and attach them right here to the application. So that's what we're going to do today. But again, you have the option to do it by any other means as noted here. So I'm going to choose electronic only. And I'm going to choose my first attachment type. So I'm going to go in order here. The first one listed up here was an IRS W-9 form. So I'm going to scroll down and select IRS W-9 form. I'm going to go ahead and upload my file. So I'm going to select the file right from my computer to upload. And you'll see here all of my attachments that I have available. So I'm going to choose my IRS W-9 and hit open. This has uploaded directly now to my application. I'm going to hit save. And now you're going to see that I have an entry down here with my IRS W-9, and up top under my attachment type, it's going to say the requirement has now been met. It's very important to note that meeting the requirement does not necessarily mean that it has been attached. If I chose that I wanted to mail the attachments here and I didn't upload anything, this would still say the requirement has been met, but it's going to sit in that holding pattern again once I submit my application, waiting for me to mail in those attachments. So I'm going to go ahead and repeat the process with my professional license. So I'm going to hit create new again. I'm going to select my transmission method. I'm going to do it electronically, upload it right here. This time I'm going to choose professional license. I'm going to go to my computer and I'm going to upload my file right from my computer. And I'm going to hit save. Now my professional license is attached. The requirement has been met. Last but not least will be my proof of professional liability insurance. I'm going to select electronic again. Scroll down to proof of professional liability insurance and go to my computer to select that file and upload it. I'm going to go ahead and hit save. Now you can see that all of the requirements have been met. I have uploaded all of my documentation right here. So when I submit my application, it's going to go right into the screening tool and then it's going to be sitting in a queue waiting for somebody to review. Once you have met all of the necessary requirements for the required documentation, you can hit save to continue. The last page of our application is the agreement and submit page. So you're going to start by reading the information here at the top regarding the terms of your enrollment. There are terms of agreement, and you'll notice that again, it has pre-populated the information here, and it pulled it from the beginning of the application. So if you see something here that is not right, you're going to want to go back to the beginning to make sure that the information is correct, and then it will repopulate it here. There are certain special provisions for certain provider types. So before you continue, you want to make sure that you are clicking on this link here, and that's going to bring you to our section of our vtmedicaid.com website, and it will note any special provisions. You're going to look for your provider type and review those special provisions before continuing. By hitting proceed, it means that you have looked to see if there's any special provisions for your provider type. Once you hit proceed, you'll notice that below is the general provider agreement. It's very important that you read over the general provider agreement as you are attesting that you understand and agree to the terms for Vermont Medicaid and the Department of Vermont Health Access. If you need to download or print this, you have the option to do so here at the top. Once you have reviewed it, you're going to agree and accept to the terms by clicking the I agree button. It's going to bring up a blue box that says, are you sure that you want to agree to the terms and the conditions of the provider agreement? And you can choose yes. That will put a little box next to I accept. Under that is going to be the provider portal registration details. So this is the person that you want to give direct access to the provider's information upon the approval of the application. So if the application is approved and the provider is actually enrolled with Vermont Medicaid, it's going to automatically generate an invitation code sent to the person listed under the portal registration details. This person will then be able to register for the provider portal in order to maintain this provider's information. So you just want to make sure you fill out that portal registration details specifically to the person you want to be able to maintain the information. Once you filled out that information, you can scroll down to the signature. You're going to sign this application electronically, and you're going to do so by clicking the I accept button, entering your last name and first name, and then you're going to want to give a verification email. This verification email is going to be the person who is completing this application. Because once I've entered in the email ID here, I'm going to need to request a verification code in order to submit this application. Once I hit request verification code, it's going to send that code to the email that I listed here under the verification email ID. Once it sends that email, I have 10 minutes to enter that verification code into here and to submit my application. So you just want to make sure that you are actually ready to submit your application when you hit request verification code. If you're not ready to submit your application, maybe you want to pause on it, have somebody else review it, go back and review it at a later time, you have the option to finish your application later. This is going to bring you right back, once you access the application again, it's going to bring you right back to the last place that you left off of. So it's going to bring you right back to the submit page, and you can submit the application at a later time. Once you start an application, you have 30 days to submit that application before it expires. If you go beyond the 30 days, you would have to start over with a new application. So I'm going to go ahead and hit request verification code. And you're going to see, it's going to say first that the verification code has been sent to the email address. I'm going to hit OK. You're going to see how fast. So I've already received my code. It comes in a matter of a minute, really, into my email. And I just copied the code from my email, and I'm putting it directly into that verification code box. I'm pasting it in there, so you can copy and paste. You just want to make sure that it is listed exactly how it is in your email. So you'll notice there's capitals here, and that's because there's capitals in the verification code in my email. If I try to put lowercase letters here, it's not going to allow it and say it's invalid. So once you have entered in the verification code, you are ready to submit your application. So I'm going to go ahead and hit the submit button. Once I hit submit, it's going to confirm, are you sure you want to submit the application? I'm going to say yes. That's going to process through, and then it's going to bring me up a confirmation that the application has been submitted. Here's my submit confirmation. It'll say, congratulations, you've successfully submitted your provider enrollment application. And it's going to make sure that you note your tracking number. Again, that's going to be sent to the email from which we registered at the beginning of the application. If you chose to either mail, fax, deliver us your attachments, you didn't upload them electronically, you're going to want to access this cover sheet. If you click on the cover sheet, it's going to bring up a document that you will want to send in with your attachments. The reason being is once DXC receives those attachments, we want to make sure of whose application they should be attached to. So by submitting it with this cover sheet, it allows us with the tracking number to easily identify your specific application, and it's going to list the items that you need to send in with that application, or the items that you need with this cover sheet. And it's going to say, again, reiterate that you need to send the documents within 14 business days in order to avoid your application expiring. And now you have successfully submitted your application for an individual provider with Vermont Medicaid. If you have any questions or need to access more information after you've submitted your application, you would definitely want to reach out to the provider enrollment team, and their contact information is located at the bottom of your screen. Thank you for joining this training video today. I hope you have a wonderful day.